Hi, this is Pamela Kay, and I am here with world-renowned plastic surgeon Dr. Michael Moses. And so many women wonder about plastic surgery, cosmetic surgery, and what types of procedures are involved, and they have just so many questions. Today we're going to actually get inside the head of Dr. Michael Moses. Welcome, Dr. Moses.
Thank you, Pamela.
Well, it's so great to have you here, and just like I mentioned, so many women have lots of questions about cosmetic surgery. They're worried about concerns, the risk involved, being natural. Some women want to be natural, some maybe want triple G-size breast or really big Angelina Jolie lips, and some women are very conservative with their procedures. Maybe they just need a little eyelid tuck or a little, chin something or other. I'm not sure the term for that, but I guess what's the best way to address women in general and their concerns about the way you view plastic surgery?
It's funny, the way you put it is you've so perfectly described the challenge in plastic surgery, Pam. A good result in plastic surgery is not a woman who's pretty. It's not a woman whose nose is perfect or whose breasts are big. A good result is a patient who's happy with his or her appearance. So that I think the challenge is not doing the surgery, and it's not those itty bitty tiny stitches. The challenge is trying to figure out what that patient wants. Does she want big lips or just slightly smaller lips? Does she want really big breast or just a little bit bigger breast? That to me is the whole challenge. It's much harder for me to try to figure out what the patient wants than it is to do the surgery.
Well, sometimes a patient may not know. You don't want perfection because that's an impossibility. And so when someone comes to you, how do you help them decide what they want?
It's about educating the patients. I have to, first I'm a real doctor, I have to take their medical history and I have to talk to them and I have to examine them. And then when I become their plastic surgeon, I have to integrate all that medical history and give them some choices. And when I give them choices, I have to educate them as to what those choices will do for them, what they will and what they won't do, and what it takes in terms of pain, what it takes in terms of recovery time, in terms of bruising, what it takes in terms of cost. I need to educate the patient so she can make the right decisions for herself, and I educate her as to what are your options, and she tells me what she wants. Then it's my job just as a technician just to do it.
Now, is your job also to say yes or no? Because some patients really want maybe some extreme procedures that some physicians are not willing to go ahead and give them the go-ahead for. Some say no, you know what, that's not going to look right on you, I'm not going to do it, I don't want my name associated with it. How do you feel about that?
Absolutely. We have to mutually agree. Both the patient and I have to agree. The patient always has the right to say, no, I don't think this is right for me. A patient can say, let me think about it, which means, see you later, I'm going somewhere else or I'm not going to have this done. But I also have the right to say, let me think about this. We don't go forward until both the patient and I are both agreed. We both know exactly what it is that I'm supposed to do. We both are clear that we know what it is, and we both agreed on exactly the same thing. And we both have to think that it's going to look good.
Realistic expectations.
Absolutely.
Nothing too extreme.
Well, in terms of extreme, there are the occasional patients who want extreme, but that wouldn't be my choice at all. I think plastic surgery is best when it doesn't look like plastic surgery. I think the best plastic surgery looks so natural that no one would think it was plastic surgery. That's not the facelift that looks so tight that someone comes up and says, oh my God, great facelift, who did it? If one of my patients hears that, I'm not complimented, I'm insulted. I want my patients to be told, you look great, you lost weight, you changed your hair. I want their friends to realize they look better, but plastic surgery not even to be in the top 10 reasons of why they look better. I want it to look like this is the way they were meant to look. Not too good to be true, just good.
Well, one of the amazing things about you is you have patients not just from here in New Orleans, but all over the United States that come to you. I wouldn't doubt even from overseas to come here because you are such a specialist in your field. How important is that trust factor that you have with these patients for them to come from all over the place for your expertise?
I want them to trust me, and they shouldn't go forward with surgery unless they do trust me. They should trust me, and they should like me, and I should like them. It's a pretty intense relationship for a short period of time. Having plastic surgery, the surgeon and the patient have a lot to do with each other for a couple of weeks. And you have to be able to read the other person. You have to understand when they're joking and when they're not. You have to trust them. You have to trust that they're going to do the right thing when you're asleep and you can't say what you want.
Well, trust is essential because so many women especially, but men this would also apply to, are so concerned about their physical appearance. They're self-conscious. So when they're coming in to see you and they're disrobing, you're really getting to see all of the flaws, everything that they see that's negative about themselves. So trust is absolutely essential because they have to feel like you're someone that's not going to judge them, but you're there to help them.
Absolutely. You know, the hardest part for most patients is taking off their clothes for a plastic surgeon. You know, they're uncomfortable enough about their appearance that they have finally decided, I can't stand it anymore, I'm going to go see somebody. So they go see a stranger, and the first thing he does after a few introductory remarks is says, go take off your clothes and show me. You know, they have gotten so uncomfortable about the problem, they finally had to go see somebody, and the first thing they do is get naked. It is a very uncomfortable experience. So it's part of my job as a plastic surgeon to try and make them feel more comfortable.
And you do a wonderful job with that.
I hope so.
You do. And I guess, do you want to leave everyone with some final words of wisdom or thoughts as far as anyone out there that is contemplating cosmetic surgery right now?
Talk to your doctor. Make sure that you're clear and that they're clear and that you really think that what they understand is what you understand, that the communications are clear. And I would urge everybody to consider looking natural. Don't think that more is better. You know, it's like Goldilocks in the porridge. This porridge is too hot, this porridge is too cold, this one is just right. There are breasts that are too small, but there are also breasts that are too big, and then there's a just right. There are faces that are too droopy, but there are faces that are too tight, and there are faces that are just right. Try to find a just right that you can live with for a long time that doesn't look like it's plastic surgery.
Great words of wisdom. And for more information, you can go to www.drmoses.com. Thank you, Dr. Moses.
You're welcome, Pamela.